And turning now to the coronavirus in Idaho, the pandemic is still in full swing and now flu season is quickly approaching.
Experts say the importance of getting your flu shot is even greater this year, and coronavirus positivity rates are not decreasing at the rates doctors like to see.
Idaho News 6 healthcare reporter Jessica Taylor spoke with medical professionals about mitigating the spread of both illnesses.
Doctors from across the state got together to spread a message. Get your flu shot. They're also reminding us that COVID is still present and a threat. The risk of death from COVID is 6 times as great as influenza. And getting a vaccine improves both your immunity as an individual and our community. Fever, cough, sore throat. Hard to tell which is the instigator, COVID or influenza. That's why doctors say to get your flu shot now.
All age groups need to have vaccination. It's especially important for those in high-risk categories. Including in that category is children. So for children, we know historically that there is about 80% of influenza-associated pediatric deaths have occurred in unvaccinated children 6 months of age and older.
The benefits outweigh the risks, especially when COVID-19 looms in our community.
The rate of serious adverse events is like 1 in a million. And that's not a made-up number. That really is the number that they see for events with the flu vaccine.
Don't worry about a flu vaccine shortage.
We've given 10,500 influenza vaccines. We're 30-40% ahead of last year.
We have ample supply and we're ready to vaccinate.
No shortage of supply.
Another factor complicates the situation.
When children go back to school, it usually takes somewhere between 2 to 3 weeks before you see an upsurge.
One doctor says they're seeing daily numbers of positive cases from children and staff in schools. Majority is community spread related, not related to the classroom.
I would say that we are seeing, not surprisingly, many positive from Boise State students.
There is no vaccine for COVID and no studies that suggest getting a flu vaccine decreases your chance of getting COVID, but the proper precautions can decrease your chances of getting both. In the same way that the flu and COVID can look similar, the ways of prevention are similar too. Wearing a mask above your nose and mouth is still recommended, as is social distancing. Doctors are also looking at the efforts done in the southern hemisphere, like in Australia, where they've already experienced their cold fall season and had a relatively mild flu season. Reporting in Boise, Jessica Taylor, Idaho News 6.